Hey everyone, this is Dr. Arash, physical therapist, and for years I've been the clinician helping people get back to their activity pain-free. Now I'm on the other side. I recently had an ACL reconstruction, and over the next few minutes I'll take you through my first week of recovery, the OR footage, my very first PT session, and my post-op visit with my surgeon. I'm sharing this journey to make this process clear and a little less daunting for anyone that's about to go through it. Heading into surgery, I had put a good amount of work into prehab and felt as prepared as possible. By the time of my operation, about 7 weeks after the initial injury, I built a good amount of baseline strength and range of motion around the knee. For my reconstruction, my surgeon used a quad tendon graft, and here's a look inside the operating room.
This video demonstrates a torn right knee ACL. We're going to remove the torn tissue and get ready for an ACL reconstruction. We can see the PCL is left. We put in our guide and we're going to drill through the femur, the end of the thigh bone, for a new ACL tunnel. We come in straight, we make the guide larger, and we drill backwards to create a brand new tunnel. Once we finish drilling backwards, there'll be lots of reamings left and we need to clear out all this extra bone so we can see. We then make our drill smaller and we back it up and pull it out, dropping a suture into the knee, pulling it out of the outside of the knee. We then prepare for the tibia. There is a guide wire for the tibia, and then we over drill it to the same 9 or 10 millimeters that we drilled the femur with. We can show you the inside of the tibial tunnel, showing that there's walls all around. We connect the femoral tunnel to the tibial tunnel using that suture that we originally placed. And then this suture can be used to pull up the new ACL graft. And this is a quad ACL reconstruction using the patient's quadriceps tendon. And here's the before and after.
As you can imagine, surgery takes a big toll on the knee. The first few days for me were very limiting and difficult. There was a lot of pain, swelling, and the quad atrophied extremely fast. My routine was basically ice, elevate the leg, use electrical stimulation for quad activation, and then some gentle range of motion exercises, especially into straightening of the knee or extension. A few things that made a huge difference was having help at home, a shower chair, electrical stimulation device, and a stretching strap to get that knee to bend. Getting into PT as soon as possible is crucial. I stayed in touch with my PTs even on day 1 post-op. My first actual session was on day 6. We did get the chance to record this, so let's show you a few clips of the first session.
How's it going? How's it feeling? My name's Andre. I'm going to be your physical therapist today.
Nice to meet you.
Nice to meet you.
Yeah, so basically, so I got surgery a week ago today, and the first 3 days I pretty much did nothing. Mm-hmm. And it felt
literally
fine.
Nothing, or were you? Because I know we'd chat about trying to ice, but it's hard.
Oh yeah. No, I did ice, elevate. Took my oxycodone. Honestly, I didn't get that bad pain that people say that once the pain
after the
nerve block wore off. I didn't really get that. I felt like the pain was pretty tolerable. On Saturday, I stopped the pain meds. I still take acetaminophen, 3,000 mg, and a baby aspirin twice a day. I'm gonna take that probably for another week or so, just like maintenance. And then on day 4, I started doing a little bit of quad sets, some straight leg raise. Honestly, even from day 1 post-op, like I tried straight leg raise, like I could do it. It's just very painful.
Actively to do it, or because I know when you showed me earlier, it was like then you let it down and you were like, ooh,
yeah,
now it hurts. So is it more after you've done some?
It depends. Like if I just do quad sets, like it's painful during.
So quad sets are painful.
Mm-hmm.
Okay.
Mm-hmm. But I try to do it. I just go light with it. Like I want to just keep engagement, but I'm understanding that like I don't want to lean too into it. I talked to Nima because I'm worried about like the quad graft issue. I'm like, if he literally cut a piece of my tendon, I don't know if I should be loading it too much.
And when you say every so often you're doing quad sets, like what is every so often?
2 to 3 times a day.
Okay, 10 each time you said?
Yeah, about.
Okay. Are you getting any are you doing any ankle stuff? Ankle pumps?
Ankle pumps. At the gym, I locked this out and I did some heel raises.
Are you doing weight bearing heel raises or on like a leg press kind of thing?
Weight bearing.
Okay. How do those feel?
Fine.
Can you maintain a locked out quad while you're
I keep the brace locked out because I don't want to
Okay.
risk the knee.
because this, pretty noticeable swelling. Is this more than it, or is this about where it's been for the last week
Yeah,
or
I
so?
know it's really hard for me to tell if swelling is increasing or not. So it's so swollen that I would say this is about how swollen it's been. Maybe a little bit better.
Like today specifically?
Yeah, I would say
Okay.
it's about how swollen it's been.
Has
I
it
would say
been this swollen in days past though? And you're just saying it doesn't get past this, which is, to be honest, a considerable amount.
it's a considerable
Not
amount.
not in a concerning way, but just
It's a lot. I don't know.
And elevating, you said when you have elevated, is I know you're like, I know it needs to be above my heart. So when you've been elevating at home, how have you been doing it?
So I elevated 2 pillows. I brought my leg up and I put my leg on top of that. Lay down during when I would rest. When I do work, I go up against the wall a little bit. I try to lay as flat as possible, and then I do the same thing. I put my leg up on the I can't mimic it here, so I might do some work from home a little bit because I really want to manage the swelling. That's probably the thing that I would be most concerned with for myself, being the idiot that I am.
Because how many times a day are you like, okay, I'm going to work on my swelling. I'm going to get this elevated. I'm going to get the ice on. Like, how many times a day are you?
Almost all day. I try to always keep the ice in rotation with the ice machine. It's really nice that I could just dump ice. Probably at least 6-7 hours out of the day.
That's actually already really good. I mean, like, even without an active quad
Really?
contraction, you're already at like 10. All right. Let's go ahead. We're going to take some circumference measurements. Sharpie dot, so I have a reference point. My best estimate based on the fact that there's bandages in the way, but we'll just... And... Okay.
It's gonna be gushing.
No, it's fine.
How big is the quad tendon that they pull for Rehab?
It's pretty good sized.
Why?
Damn, it's swollen.
Part of
So what I'm doing here is I'm just adding like just a little bit of pressure because I want to make sure that nothing is kind of, that suture is really holding really well and nothing's kind of coming out necessarily, because that also gives me kind of the go ahead to like work a little bit on this. I'm still going to be cautious. Like, I'm not even going to use any like massage cream or lotion for this. Typically I would, because that would help kind of facilitate just less friction, but because he is kind of more post-op, I'm not going to get any lotion or anything near the incision site to start with here. So okay, that's pretty good other than the swelling. So now I'm just gonna basically kind of help flush and facilitate some of the fluid out of the area, because I don't think anyone has done that for him yet. And sometimes, if fluid just stays kind of stagnant, if we don't move it, which of course he can't because he's locked in that brace as he should be, but as a result, that fluid's not really moving anywhere, so it just kind of pools, it just kind of sits, and that is going to be a big contributing factor to not only how the joint actually responds, but that's also going to inhibit how much activation the quad can get, because it's being, essentially there's pressure being put on it by surrounding fluid, so that limits its activation. So we're going to see how much we can get just by kind of working on flushing some of this out. You're going to maintain a quad contraction as best you can. This is going to be assisting you, so I want you to use this. Like, I don't want you to fight through like, no, it's okay, I can get my quad, because right now we just found out you can't. So as best you can, you're maintaining this contraction, but you're going to do straight leg raise while assisting yourself up with this.
It's painful.
And if you need to, you can use like both hands on.
Oh, Andre didn't come over. He was gonna give me a sponge bath.
Progress through some straight
Single
leg
leg
raise
free
stuff.
throws.
See if you can do maybe a side lying hip abduction to get some activation. Probably go through some ankle pumps.
Shortly after my first PT session, I had my 1-week follow-up with Dr. Nima Mehran alongside both of my PTs. We discussed my progress with knee range of motion, strength, bracing management, when I could start driving again, and potentially post-op complications. Here's a look at that visit.
So this will get better and better. the most important thing right now, right, terminal extension, which he has great terminal extension passively.
Yeah.
You can't actively
Yeah,
hold
yeah,
fully, but you're a few degrees away, man. You look really good.
Pretty good.
In terms of the crutches, the crutches are there for help, right? So like I want you to use them when you're walking right now, where you don't have full strength, you still have a lag. But the moment, usually takes about 2 weeks. The moment you two feel like he's lag's gone, he's walking well, then we can get rid of those crutches.
And I don't swell afterwards. I think
You're
that's
gonna swell no matter what.
Yeah.
In the early stage, right?
Okay.
Because we just did the surgery.
Yeah.
Most of that swelling was created by me, not you. Remember, we put so much
Thanks for
fluid
taking the
into your
blame.
knee. Yeah, it's my
I
fault.
get a lot of the blame.
Yeah, no, we put so much fluid into your knee, right? While we're doing surgery,
Yeah.
several liters are going
That's
through your
true.
knee, and
Yeah.
depending on how long an operation is, there's more and more liters, right? So
Yeah.
there's so much saline in your knee, right? That's causing a lot of the fluid, and then over time it's just going to dissipate. You have a decent amount of fluid in there, but you also, you're a rock star. Go ahead and take your knee and slide it back. Do a heel slide. Go as far as you can. Okay.
And with this, don't worry about this discomfort much either.
All the discomfort should be there,
Yeah.
the majority, because that's where we took the graft.
Right.
So donor site morbidity, right? Meaning like the place that you took that graft is always the most painful, which is why allograft ACLs are less painful than autograft because we didn't take a graft. Now, something you can work on at home when you're not with your therapist is imagine there's glue on the bottom of your foot. Okay, so I'll put my foot there just for now. And then in your chair, just slide forward a little bit
Yeah.
and push forward. Keep your butt down though. So just slide forward.
Just slide, just shift
Yeah.
the weight forward.
Shift your weight forward.
Yeah, I feel that.
And then as you're sitting there, just watch Netflix, hang out,
Yeah.
hold it for a minute or two,
Yeah.
and then relax, and then try to go a little further.
Yeah.
That's one really good exercise.
You're not worried about going too far right now.
I'm not worried about anything.
Not anything. Okay.
We didn't have to do any kind of meniscus root work, nothing.
Yeah,
I have zero
yeah.
worries.
Okay.
And your ACL feels fantastic. The only thing I want you to do is work on your range of motion.
Yeah. Extension looks good. It's just the active aspect of the end, and then flexion. Just slowly keep working on.
Yeah,
it.
and literally sit there with your heel out on a coffee table and go.
Yeah.
Dude, you're not
Exactly.
even in that much pain compared to an average ACL.
I'm actually in almost no pain. That's the crazy part.
Can you say that again?
I'm in no pain. Like no, it's honestly crazy to me.
Painless surgery.
No, it's crazy because that's why I probably do too much. Is because I feel so
Yeah.
good.
you're
Especially compared
definitely-
to post injury, I was in a lot more pain, and it was very, very difficult for me to move around.
Yeah.
They had to push me to move around a little bit, but like
this is a more controlled setting than
Yeah.
you tearing your ligament
Yeah.
and bleeding everywhere, right?
Yeah.
So it's less barbaric in a sense. So you just keep working on putting your heel out on the coffee table or on top of like a stack of towels, and think of your kneecap like you're trying to get it into the ground. Yeah, drive forward.
yeah,
Just really stretch the back of the knee.
yeah,
Work on that, and then fire the quads. Keep doing that. Quad sets.
yeah,
And then try to hold it, and then take your leg off and elevate it.
yeah. No, that's good. Work on end range. We were doing some like towel banded work. Yeah,
Great.
that was good.
They're better than I am at this. You're firing a lot.
Yeah.
So in terms of
What about sleeping with the brace?
you don't need the brace to sleep.
Because
You already
I have good range of
You
motion
have great
right
range
now.
of motion. Yeah.
Okay.
The brace is just there to protect you.
Yeah.
It's more than anything. One, obviously, we talk about not walking with a lag, so we're
Yeah.
protecting that lag a little bit. Some people don't use a brace after ACL surgery. I like to use it.
Really?
Yeah, some people don't.
Wow.
I like to use it because I'm more worried about what other people can do to you rather than what you can do to yourself. It's a big red flag. Someone just had surgery. They're out and about. People are more careful.
Oh, totally.
It's more about that for
Yeah,
me. I'm
yeah.
trying to protect you from others, right?
Yeah.
But yeah, brace is gone at night. Brace up to 4 weeks max, right? No more than that. Most people can get out of it around 2 or 3. I got a patient, I got sent to me. Patient did a BTB, buddy did it, and then wasn't wearing a brace, was in a movie theater, slipped on coke, 2.5 weeks out, slipped on coke, fell, broke the patella. Well, if the brace was on, chances are she's not landing on her patella. So I just did major surgery on someone, and my thought process is, I'm not worried about you wearing it in the house. I want you to protect yourself when you're outside the house. I want you to protect yourself when, a 16-year-old wants to hang out with their friends. They're going to go do what they want to do. Like you're kind of protecting them from like letting everyone else know, hey, be careful around them. Yeah. That's my main reason. It's not for anything medical.
I don't know about you. I still recommend my patients. I'm like, look, if you're like one just went to a Dodger game this weekend, I'm like, wear it when you go there.
For
Soccer
sure.
game,
Yeah.
whatever, like,
He'll be 3 months out or like 2 months out, and he'll be like, hey, I want to go to Disneyland, and this person just had an ACL, PCL, and they want to go to Disneyland. It's like, okay, well, why don't we wear it that day? A few hours here and there, just like let everybody know. Be careful with this guy. Yeah, yeah. It's a big red flag. That's all it is.
It's very helpful actually. When I did Vegas and Mexico, just having that on by itself.
People open doors.
Yeah, people open doors.
They're trying to help you out, make sure. Yeah,
for sure. Yeah.
Like also like imagine going on a plane and you just 4 weeks out of an ACL, you're gonna fly and you have a 25, 30 pound bag, you're gonna flip up and you're having trouble and then you fall. It's just someone goes, oh, let me help this guy out. Like,
Exactly.
it's just nice. People are a little bit more kind.
Yeah.
That's why I like it. It has literally nothing to do with function.
Yeah. And something else is he usually waits 4 weeks for people to fly.
That's dogma. That's just how I was taught. I've always just continued it. The idea is that blood clots are worse, right? Your risk of blood clots can increase. So you're trying to get out of that early stage. But if some people will be like, well, didn't Aaron Rodgers have surgery and fly like a week later? Yeah, he's probably flying on a private plane. And he can also tell the pilot, my swelling's getting really bad, my pain's bad, this is rough, let me stop. But we don't have those options. So it's...
Yeah, it's different.
Real quick, in terms of flying, I would take 325 or 81 twice, so 162.
320, 81 twice, yeah. I have 81 2 times a day right now.
But that's for blood clots for 2 weeks. That's just separate.
Okay.
But if you're going to fly, I would just take 325, just a normal aspirin.
Okay.
Take it 2-3 days before, and then all the way through 2 to 3 days after, just to be safe.
That's over the counter?
Yeah, over the counter.
Okay, and the acetaminophen I'm still taking 1,000 mgs 3 times a day.
Okay, cool.
Just run the course of that.
That's
right?
amazing, dude. Yeah.
Okay.
If that's all you need for pain, dude, you're crushing it.
Yeah, honestly,
You're way tougher than I thought.
Really?
Yeah.
Get that on camera.
I was expecting you to be a little bit wimpier.
No. I mean, I overdo it if anything. So like, I need to be told this is going to irritate, or else I'm going to do too much.
Driving. So right leg, right? Once someone's off narcotics, in theory, like they should be able to drive. Break time studies in general from like several different types of knee surgeries show that break time comes back around 6 weeks. You didn't have any meniscus work, so I'm not really worried about you causing pain, but you would have significant swelling and pain if like all of a sudden someone cut you off and you slam on your brake. So what I would suggest, since you're already off narcotics, is probably around week 3 or 4, why don't you go into an empty parking lot, start driving around a little bit, see how you feel, see if it feels okay. If it feels okay, you can do it. If it's really not a big deal, then just wait the 6 weeks.
6 weeks, okay.
So are you saying break time, like the reaction time?
Break reaction.
Someone had to slam on the brakes. It takes about 6 weeks.
To recover, to normal. But that's the biggest thing, right? Because also like what happens is you're going from like brake to gas, and then you go to the brake, or like someone's foot gets twisted or caught, and they go, like the pain, it's just not worth it if you can avoid it. If this was your left knee, I would tell you to drive now.
No.
And you also want to make sure you have nice full range of motion. So completely off narcotics, full range of motion, and then drive in a parking lot and see how you feel. And if you feel okay, then it's reasonable.
Yeah. Okay.
Sorry, if someone doesn't do a notchplasty, does that like increase their likelihood of ending up with a cyclops lesion, or no? There's no correlation.
No correlation with that at all. It's the notchplasty is more for making sure that the graft's not touching the wall. I don't do it on everyone. It's just, so what I do is after I drill my tunnels, I drill my tunnel in the tibia, and then I drill my tunnel in the femur, right? When I drill my tunnels in both bones, I then take the rope, which is the passing suture. You saw there's a suture on the video that pulls the new graft in, and then I make it really taut. I have my assistant hold it really taut, and then I can kind of imagine, is that graft close enough to that wall? If the answer is yes, I push the rope back and I take a little bit off. If not, I don't do a notchplasty in everyone. I treat every patient differently, because I think if you go through the process of doing the exact same thing for everyone, it'll work most of the time, but sometimes you're being over aggressive. Yeah. Everyone doesn't need everything, right? It's not the same surgery every time.
And then the rope is secured down through the other side on the tibia.
So the rope over here, it's attached to a button, and that's gone through the graft, and it's called suspensory fixation, and that's hanging, right? And if you were, 23-year-old athlete that was still playing collegiate soccer, 21, playing collegiate soccer, we would be using your patellar tendon. I'd be using screws on both sides, right? But you and I had a deep conversation about what your goals are and being a recreational athlete and all that stuff. And so it's nice because you can avoid the anterior knee pain. We use the quad. We don't have bone blocks on both sides, so I use it more as a soft tissue graft, right? And then I take that quad and I use suspensory fixation. I don't suspensory fixation meaning there's rope hanging it, right?
Yeah.
There's not screws.
Is that the
next to
button
it.
that you're talking about
That's
for
the
the
button.
X-ray that you'll see?
Yeah.
Okay.
Yeah. Get full range of motion. I like to see you between week 4 and week 6.
Okay.
And then we, well, I'm going to see you sooner because we're going to touch base on the possible cellulitis, right?
Yeah.
So you'd let me know in the next few days. And then we get our range of motion back. You know, the two of them are going to work with you on strength.
Yeah.
No limitations. I think squatting for now, just around 90, because like deep knee squatting just causes a lot of swelling. And then BFR,
Yeah.
right? Closed chain, open, and then start doing open chain as you start like kind of maxing out with closed chain and BFR. The only reason open chain is relevant is because it increases patellofemoral contact pressure. Yeah. So a lot of people are always talking about the graft. That's one side of it. Can it loosen a graft is like the concern or whatnot. Yeah, that's one part of it. But it's really, if you take a patellar tendon or a quad, that contact pressure can cause pain, and then the knee can get angry if you do it too early. But the way you guys now do it with BFR and no load, it solves the problem.
Yeah.
So it's not really a big deal.
So you're more okay with BFR with open chain.
I would wait
with
on
no
BFR because of that for now.
Okay. Yeah.
So let's just wait a little bit, and then you're already ahead of schedule.
How long should we
Let's just wait to see when that totally resolves.
2-3 days. We'll
Yeah,
make sure.
we'll touch
and then-
base, and then probably a week, and then we can go. And then shower normally. We talked about showering.
Yeah. Start showering. Okay.
Start showering before you're single again. Start showering. Dab the incisions. Glue will take several weeks to come off.
Yeah.
Incisions look great. And then pain control. How you doing on pain?
Pain's great.
Totally
No
fine.
pain. I mean, pretty much no pain
Nighttime?
unless I'm. The only thing with nighttime is the brace. Like that's where
you don't
I
have to
get which is fine. Without the brace, I feel like I'd be good.
But
And
no, brace wouldn't influence his range like in the morning. So like if he wouldn't wake up kind of like stiff and in a flexed position.
Yeah. Oh, you mean
Like,
will
if
it?
he doesn't wear it.
Well, no, not at all. Because he naturally can do it now. Before, one of the main reasons we also put people in a brace is because depending on where you work and how quick patients can get into therapy, some patients naturally sit in a semi-flex position. And the best, as you guys know, terminal extension matters way more than terminal flexion. So to downgrade the risk of them losing that terminal extension,
he's biased towards that.
yeah, because there are places like in my old job, sometimes there's patients who didn't get therapy for 10 to 14 days. And you imagine that's gonna be tough. So it kind of helped us like keep tabs of them and make sure that they follow some of the instructions. But with this, and he has a concierge therapist who'll pick up the phone call at 2 a.m. I mean, I'm not worried about him. It's a little bit different.
The first week was definitely challenging, but having a good support system made all the difference. So that wraps up week 1 of my ACL recovery. We'll continue to document the journey. Let us know if there are any other topics or questions that you want us to cover next. And if you're going through this yourself, we did put together a free ACL survival guide that you can download. Plus we have a structured ACL program that'll help you both pre-op and post-op. You'll find the links below in the description.